Rewinding to our earlier discussion, you brushed over back surgery. I know you're neither pro nor anti surgery, but instead recognize that there are occasions when it makes sense. But I also know that you sometimes advocate what you call virtual surgery, in which people with severe back pain go through a period of acting as if they've just had surgery. What would you say to someone who's contemplating back surgery?
Read chapter 4 of my book, Back Mechanic. Well, I wrote that book for a reason, Greg, and it was to help people, and it was missing in the public space. So I didn't want to spend 5 years writing it, believe me, but I did. The book chapter starts with some fairly stark statistics. When I started the experimental research clinic at the university, which was over 25 years ago now, one of the mandates that I put in was we had to follow up with every patient. We're the only clinic that I know of in history, really, that followed every patient that came in. We knew what their diagnosis was from our thorough assessment. In follow up, we knew if they complied. We knew what else they did. We knew if they got better or not, and we documented it. We know exactly what our success rate is, but it depends on the subcategory of the person's pain mechanism. So now I'm going to give you a category that answers your question. If the person was told, you've tried physio, chiro, you've been with a strength specialist, you've done yoga, you've seen the surgeon, you've tried it all and you've failed. The last hope for you is surgery. So, if that's the category that they came to us under, I can tell you that after doing the program in back mechanic and in a 2 year follow up, 95% of them who were told the last available thing for them was surgery, 95% of them avoided surgery and were glad that they did. So, there's a statistic that we measured and I can stand by. Now, having said that, is there a time for surgery? Absolutely, there is. So that's the rest of the chapter. Talk to your surgeon, get a second opinion, and has the surgeon proven that the pain mechanism can be altered with a knife? If there are more than one surgical targets, the chance of you getting better has just gone way down. If there's three sources of back pain and he's only going to cut one of them, what's the chance of you getting better? Not much. So uh, we have all of these discussions and critical questions you should ask the surgeon to enhance the chance that the surgery is going to be very successful. That's the chapter. And go talk to the rehab person who works with that surgeon, and they will tell you whether the surgeon is good or not, because they might be responsible for rehabbing the patients of three surgeons at that particular hospital. They know one of those surgeons has nowhere near the success of the other two.